I'm chatting today with my good friend, Dr. Catherine Kovacic, and our discussion will focus on what happens to the physical body after death occurs. It's a topic that's not often discussed in relation to the death of our animal friends. We usually know what to do when humans die because there are rituals and processes that kick in. But with animals, accurate information, it just seems to be less available. I have been with my non-human animal family when they pass, and because Rosie's Hospice of Compassion, it's all about providing palliative care, death happens fairly regularly here. But I have friends who have felt really panicked at the time when their animal companion has passed because they've been frightened about what will happen to the physical body after death. So Kath is the perfect person to discuss this topic in an informative and compassionate way. There are just too many videos on YouTube that talk about, the gruesome things that happen to the body after death. So we wanted to provide a more accurate account of what actually happens. So there is no need to make rash decisions about what to do when animal friends pass. Kath is a former veterinarian, so she draws on her training in veterinary science and her lived experience with her patients. She moved away from practicing as a vet to earn a PhD in art history, focusing on the important human-animal connection throughout the ages. So Kath is a double doctor. She is Dr. Kath. In the past few years, Kath has become a renowned author with 12 published books in circulation, including murder mysteries, true crime, and a book about dogs. Because dogs are her passion and dog training, and this is how Kath and I met. We met through the most beautiful, stunning Borzoi named Leonardo. Hello, Oberon.
just coming to join this
fish. You talk about Leonardo. Hi, Kath.
Hello.
Shall we talk about, we have to block Oberon's ears, but let's talk about Leonardo. Can you tell us a little about?
Yeah, I've got his picture here so you can see my lovely Leonardo.
Oh.
And so he's a very special Borzoi. He came to me, he was about 16 weeks when he came to me, and I hadn't been expecting to get him. I'd lost another dog not so long before, and I hadn't been planning on getting him, but unbeknownst to me, his lovely breeder, who knew what I'd been going through, she'd specifically kept him for me, knowing that there would be a point where I'd be ready. And she is one of those people, she would have kept him as long as it took. If it had been a year, she would have kept him, because that's where her heart and mind are.
Wow.
And she didn't tell me. She didn't tell me at the time because she knew I was going through too much stuff and wouldn't have been in a place to even think about it. But when she thought I was ready, she said, well, I've got him here for you. And she'd chosen him from the litter of puppies for me, to match my personality. And I think from the moment we sort of set eyes on each other, we knew she'd got it right, because it was just, there was this instant connection. And he was a bit of a shy boy. And I think that was when we first came to you. He'd been to some other classes, and I could see he was struggling with that different class environment. And so we were looking for somewhere where we could grow together and he would be comfortable. And so I think when we first came to you, he was still very much in his shell. But I knew the little doggo that was in there. I saw those little flashes of his big personality. And I think you saw that slowly come out over those weeks of early class.
I remember when I met you, I could tell that you knew there was something in there. I couldn't see it yet, but you adored him.
Yeah, and he was just one of those dogs that there's just a connection there. I mean, we all have connections with our animals, but there was something special about the way he would communicate with me. What he could tell me with his face, with his body, and with his eyes. And the way we could sort of interact together, that we could sort of be on other sides of the room, and I could look at him, he'd look at me, and we're just like, okay, we're doing this. And we could be out on a walk, and I'd think, oh, we might go a different way, and we'd get to that corner that we hadn't been around at all for the past 10 weeks, and he'd just go around the corner. And so even though he was he's a side hound, he's a borzoi, and they're one of those breeds that people tell you, oh, you can't train them, they don't do this, they don't do that. But he was just, he was up for everything. I could see how much he relished just going out and doing and being together. And whatever it was, he's like, yeah, let's give that a crack. And sometimes he'd be great at it, and sometimes he wouldn't, but he'd give it a red hot go. And then if he wasn't great, it would just like, yeah, well, that was fun, let's try something else instead. So Leonardo was 8, and it was during the start of lockdowns and things. He actually got quite a mild gastro, and actually both the doggos got it, and Oberon sort of bounced back and he was fine, and then Leonardo got it and he was fine. He got over the sort of the vomiting stage, but he just wasn't quite right, and there was something just nothing you could put your finger on, except he just seemed a little bit more lethargic, not even lethargic, just not quite himself. And so we went to our fabulous old vet, who's now retired because COVID, and he couldn't, at first he couldn't find anything. And so because he's that old school vet, he went back over everything again, and he put his stethoscope on Leonardo and he kept it there. And about 40 heartbeats in, he went, oh. So there was just a little irregularity. So not that, what we call the washing machine, not that sort of slushy dilated sound, which is really obvious, just normal heartbeat. And then every 40 beats, there was just a little skip. And we discovered that if his heart was beating faster, if we'd gone for a run, or if when he just got into the vet, it disappeared altogether. So it was just this odd little nothing. And he's like, okay, well, probably that gastro, it went into a little cardiomyositis or something like that, an infection of either the heart muscle or the stuff surrounding the heart. So you high-end antibiotics, a couple of different varieties, and you just make sure there's something there. You're probably not going to see it in the blood because of the way the heart is structured, but hit him with the antibiotics, and we keep monitoring his heart. And he went off to the heart specialist so they could do an ECG and all the imaging, and of course the heart looked perfectly normal, but there was still that odd little irregularity every 40 or so, which is really nothing. When you get something like that, it's going to be every 2 or 3 or something like that. And antibiotics, nothing was showing in the bloods to say that we had any ongoing bacteria, but we still had this little one every whatever thing. And so you don't tend to, especially with something like that, you wouldn't give a person a pacemaker with just a little skip like that. And certainly dogs, you can pace dogs, but you tend not to, because as I'm sure you're aware, if a person has a pacemaker and their heartbeat gets irregular, they know that they're going to get the shock, and they can brace themselves, and they know it's going to hurt. But you can imagine how that would be for a dog who would have no understanding that they're just going to get this jolt out of nowhere. So you wouldn't do that to a dog, really, because that's this punishment basically coming from nowhere. And so we thought, well, okay, we've done all the antibiotic stuff. There's nothing showing up. This is all we've got. The heart's fine, and there's like a 1 in a huge nothing chance that he could have a heart attack at some point. And why would he? Because it's such a, what's going on is such a rare thing anyway. What's going on is such a minor thing anyway. And then he had a heart attack. And it was a Saturday morning, and we're all in the kitchen. Oberon was there too. And he was waiting for his breakfast, and suddenly I saw his face change. And he sort of staggered sideways, and I managed to grab him, and he got onto the floor. And at first I thought he was having a seizure, because he sort of, he flipped his legs out, and I could see he was distressed.
Yeah.
And then I realized what was happening. And so Oberon was there, and he was very upset. And Leonardo howled. I don't think he was ready to go. He howled. Not that he was in pain, but just I think he knew what was happening.
Yeah.
And then he was gone. And I did CPR. And I still think, should I have done more CPR? Should I have gone harder? Should I have gone longer? Should I have really pushed it? But we lost Leonardo. We lost, So we're we're 2.5 years on now, and I still think, should I have?
Yeah.
And he'd been on some extra, like some homeopathic heart things as well. And so that was it. Saturday morning on the kitchen, 8-year-old boy who was perfectly healthy other than that, and he was just gone like that. So
it's just so shocking. It's they're just for such a big life to end that way.
And as I said, I think he wasn't ready to go, and Oberon was terribly distressed. Afterwards I think he was prepared to let go and die. He's a young dog, but he was so upset to lose his friend that I thought I was going to lose him too.
Yes.
But
Yeah. And that connection with you and Leonardo, it was otherworldly to me. I just because I see so many people and dogs, and everybody, you know, is connected to their dogs in a special way. But Leo and, you know, you and Leo, you were just twins together. It was like you almost had the same thoughts at times, and definitely the same sense of humor. Yeah, there was just like, it was just such a joyful time. I remember once you said to me, life with dogs is meant to be joyful. And with you and Leo, that was, I always get the picture of this big joy. You know, even if I would spot you from a distance, I'd look and I'd go, those two are having a ball. No.
But yeah, he'd just have this little way of looking at you sometimes. You know, you'd just be walking down the street and suddenly he'd just sort of go, hey.
Yeah,
and just do this little side look. And it would just be like, we're having a good time. We're having a good time.
Yeah.
You know, and it was just, yeah, so much personality there.
So much.
And yeah, and I think that's absolutely true. Life with dogs is meant to be joyful.
Yeah. Yep. And then it can be so hard. And thank you so much because the reason I wanted to ask you about Leonardo is because I want people to know that you're not just saying this, you know, from a clinical point of view, this topic, you know, this is what happens after death. You are somebody who has loved so deeply, you know, the deepest connection with Leonardo, and you're somebody who has the knowledge to explain what happens to bodies after death, but we're going to do it in a gentle way.
And I think, I don't know if you can see some of my people behind me. You know, I have these old pictures of people and their doggos, and I think that's part of what it's all about. You know, and there's some of these really old cabinet photographs where the people are just looking at. I don't know if I can reach with my thing on. Hang on. Going off script here a bit.
That's good. I'm glad you took your headphones out and did.
This is, I mean, this is the sort of thing that the way this guy is looking at his doggo, and he must have paid a fortune to have this taken in, you know, probably about 1890.
Yes.
When photography wasn't cheap. And so he's gone to the trouble of, you know, taking his doggo into a professional studio and having that done. And so that's, you know, that's what having a dog is.
Yeah. That shows the connection.
Yeah.
Doesn't it? Is that photo in the dogs?
That is not, because this is my private stash here. These are the people that I find in my travels. So there's a lot more all over the place. But yeah.
Wow. Gosh. Well, shall we start now to just talk about what happens? So when we've been with our beloved who has passed, how do we know that they've gone? What is the definition of death?
It's really interesting. You know, I was looking at this after we first started talking, and so many places will just say, well, death is the cessation of life.
Yeah.
It's how unhelpful is that?
Yeah.
But at the same time, I think that also it shows that it's really a continuum, isn't it? There's no easy way for people to say, well, this is death, because so I guess if we're thinking of it perhaps from a more scientific point of view, it's the end of all those vital biological functions that sustain life. That's perhaps a better way of looking at it. So, and it's not just those big picture things like the breathing and the heart and the brain. It's right down on a cellular level where they're also not getting the energy and the vital things that they need, so they can't function anymore. So I think that's really what it is. It's the end of those vital functions.
Okay. So if we're at home with an animal who has passed, because often when someone passes, you can see that they've stopped breathing, that type of thing, but occasionally there'll be another breath. Is there a way that we know that death has occurred, that we can be safely sure that the physical body has died?
Yeah. Well, certainly from a big picture perspective, feeling for the heartbeat. So the left side of a dog or a cat's chest, for example, just at the point where the elbow would sit, if you keep your hand there and keep it there for more than a minute, because the heart can become quite slow. Usually in a clinical setting, you might feel for pulses and things as well. But again, that's a really hard thing to do if the blood pressure's already down and the heart's low. So hand on the chest for more than a minute. And if you've just got a gentle hand there, you're also going to feel if there's any slight rise or fall, if there's still any breathing. But the real thing that we see is after, maybe 3 to 5 minutes, you get that pupil dilation. The pupil dilates and becomes fixed like that. And that's perhaps the easiest thing to see when you're at home, that
Yes.
the animal has passed. There are other little things like the blink reflex. If you tap very lightly in the corner of the eye here or here, an animal is always going to blink, even if it's just the tiniest flicker in someone who hasn't quite passed yet. But always the eye is the easiest one to tell. And then you can start to see pallor fairly quickly in the gums, because the heart's no longer pumping blood into those tiny capillaries. But obviously, a sick animal with low blood pressure can be pale too. So always the eyes is the easiest way to tell.
Good. That is just so helpful for people to know. It's something that you want to know before the time comes. Most of us don't have that knowledge before it comes. So thank you. Thank you. Okay. I wanted to then talk about what happens next. So the body, goes into rigor mortis. Can you talk a little about that?
Yeah. Well, as soon as you've lost the blood pumping and the heart moving, your cells are sort of starting to die. But I think I just want to go back because you mentioned that last big breath, and we should probably talk about that, because that can be scary to people if that happens. So, and that's so often you might have an animal that it's essentially already passed, the heart stopped beating, and you get this last reflex action that causes the diaphragm to contract, that causes this big breath. And sometimes it's the horrible origin of that expression, the death rattle, or in medical terms, the agonal gasp, which sounds just
what a horrible way to describe it.
Isn't it awful? But it's just this reflex contraction of the diaphragm to in an attempt to pull air in. And it sounds awful, and it also can look awful because it always seems to happen just at that point where you think, they've gone. And then suddenly there's this big gasp, and it's frightening if you don't know that it can happen. So I think we had to mention that first of all.
Yeah. And also that it doesn't always happen.
No,
does it? So we don't have to be worried about, when's that going to happen?
That's right. So what happens next, you're asking? So on a microscopic level, cells start to break down almost immediately. The first thing, long before we get rigor, sort of within that first 15 to 20 minutes, you're going to see the body becoming pale. And, if you have a dog that has, thin fur or skin that you can see, you'll see it there. But again, particularly in the gums, you'll notice it there first of all. And then if your animal's lying on their side, you're slowly going to get blood pooling to that downside, first of all, just from gravity. And then as that sort of cellular breakdown goes on, you're going to get some blood leaking out of the small capillaries. So you will get a darkening of the skin on the lower side there. And the other thing that's happening almost immediately is the body is starting to cool down to the temperature of the room that you're in. And then we get to rigor mortis. So that's the stiffening that we see after death, which I think everybody knows. And you'll first see it in the head, usually in the eyelids, the lips, things like that. And then it's sort of, you see it start to occur in other parts of the body through the torso and the limbs. And it's not that it starts in the head and moves through the body. It's just that you see it in those tiny muscles first, and it only becomes obvious in the big muscles later on. And what's going on there is that muscles are contracting and expanding all the time in life. And you have these two little protein fibers called myosin and actin, but they also need energy to function, which comes back to our discussion about what is actually death. And without energy, they become locked in their little relationship. And so the muscles stiffen because the actin and myosin are locked, and the joints also lock up. And so that's probably going to begin a couple of hours after death. You're going to start to see it in the face, and then through the whole body in probably about 6 to 8 hours. And then it stays there for about 12 hours, perhaps a bit longer, and it will gradually disappear. And again, you'll see it happen in those small muscles first, moving through to the bigger muscles, because those actin and myosin, those proteins, are actually starting to break down themselves now. So they unlock. And then you get the body, after about 36 hours, you're back to a relaxed, limp body.
Yes. So sometimes people who are not with their animals when they pass, they come home and they find that their animal is in rigor mortis and can look strange.
Yeah.
So it's good to know too that the rigor mortis will soften, that their body is going to come back to a state that you can move them around. If you're wanting to just wait for that
absolutely.
to happen.
Yeah.
Yeah. It's a nice relief, I think, to happen.
Yeah, but I
So,
think it's, again, this is good that we're having this discussion, because so many aspects of this are frightening if
yes.
you don't know what to expect and what's likely to happen next.
Yeah. I've had I've had chickens and dogs, when their body has relaxed the rigor mortis, you can actually feel like they're back in their bodies for a little while.
Yep. Yeah.
It just feels you've got that same weight, that same last cuddles,
Absolutely.
opportunity for cuddles, I should say.
Yeah.
People react differently. Some people would like to, have the body taken away straight away, but then there's others who like to have the body stay with them for longer. And I know that with me particularly, because the animals who have passed have been in a state that they've needed such care, for such a long time, that I feel that, that the death is just a continuation of that life. And, some of us believe that the animal's spirit, of course, is still in the bardo, and, we don't want to whisk their body off too soon. There's different reasons for keeping them with you, and everyone's different. But just want to let people know that it's not a huge rush, and you don't have to be pushed into what to do next. I've had my dog with me for 4 days. I've had my rooster with me for 7 days. And this is where I'd like to just talk about what happens, because there is some leakage, and there are some smells, but I know just watching, videos on YouTube, that can be blown out of all proportion to, how horrific that is. If you can just talk to us about what leakage is likely to happen and what we can do to help, really.
Yeah. So leakage is that's something that you're likely to see fairly immediately after your animal has passed, simply because even pre-rigor, because that's the relaxed state where bladder and bowel are going to let go. So having things like pee pads there, something that you can easily move out from underneath your animal, if that happens. And it's not always going to happen. It's going to depend on the animal. It's going to depend on what they've been drinking. It's going to depend on, their age and all sorts of things like that. So it might not happen. But again, nice to know that it could. So pee pads, old towels, something like that. And it will happen then. It might happen again later when you've got a little bit of breakdown of internal tissue. But I think really immediately after death is the potential for smells, as you said, with those things. And so just to be prepared with things that you can easily clean away then, and have your animal positioned in such a way, if they've been comfortable that way, you can just move them a little bit, so that you've got easy access to pee and poo if it happens.
Yes. Pee pads are just so helpful in that situation. And an air purifier.
Yes.
Because it's
even nappy bag liners, you can buy bags that are for people who have stinky nappies at home, and then so have something like that ready to whisk all the grubbies into, and it's done.
And we we're quite lucky in Melbourne because our temperature doesn't get that hot, and when it does, if we're in air conditioning, we're not likely to have the bodies of our animal companions decay quickly. But ice packs underneath can help.
So if even if it's in winter, you turn off the heating in that room or open a window so you've got cool air coming in. Dry air is better. So even if you usually have a humidifier in the house, you might want to take it out of that room and keep that room cooler. And as you say, ice packs, and you can get a very good one called, the usual freezer brick things wrapped in a towel are great, and you can have some in the freezer and some with the animal and rotate them. But there's an Australian one called Techni Ice, which is actually dry ice packs. And so
Okay.
they last much longer than the gel pack sort of things or the bricks. And they don't get wet as they sort of come to room temperature. So they're really good. They come in sheets, but you can cut them into all little squares and things.
Seen them actually.
Yeah. So
What a good use for them.
they're really great. Yeah.
That's so helpful too, isn't it? Just to not have to deal with the wetness underneath if the ice melts
and
a
as I
little.
say, they last a lot longer too with being cold. So it's really, really great. Yeah.
Good. And you can use oils and things to
Yeah. So
anoint the
I
body.
suppose, historically, when you sort of look back at records of cultures that would do body preserving or have their loved ones out on display, lavender and rosemary are the ones that come up repeatedly in the ancient recipes. As you often just also get the aromatics like marjoram and thyme, and myrrh is actually a big one in the older methods.
Okay.
But rosemary and lavender are always useful to have on hand, I think. Yeah.
And just a beautiful, relaxing smell too, isn't it?
Yeah. Have you used oils in the past, Nicole?
Yeah. I always use lavender. Just to, and I also find that in my experiences, the smell has never been overwhelming for very long. It does happen, but it leaves. If you were to leave a dead body to decompose in your house, of course that smell is going to be revolting, but we're not doing that. We're talking about days, days, and we know we can relax a bit. The gases might come and.
Well, that's right. So the smells that we actually get come from bacteria once they've moved into the body and start breaking down tissue differently. That's the primary source of smells. And in a cool environment, that can be anywhere from 4 to 10 days before that bacterial process really begins. And some of that might depend on what the animal has passed from. So if they passed from some sort of infectious cause, say they had a peritonitis or something like that, where they've already got a big bacterial load in their body, that's probably going to happen faster because the bacteria are already there. But if they've passed from something like a heart or a cancer or something like that, they're inside. It's that's not a sterile environment, but it's a clean environment. It's not out in the dirt or something like that. So 4 to 10 days before you're really going to get the bacteria coming in and starting that process. So you do have time, where it's not going to, as you say, you see all these horrible things on television shows and YouTube where it's, it's been 2 days and it's
exactly.
whatever.
Or people thinking that there's something psychologically wrong with you because you just want to spend a bit of extra time.
And look, I think it's also it's helpful for other animals to have the chance to see their loved one has gone too. I think that's really important if it's possible, and it's not always possible, but it's good if they can. I think have that opportunity. Yeah,
it is. Yeah, this is good. It just I think the message is don't be rushed.
Yeah, I think it's such a horrible time, and it's such a confusing time. And if you've got a professional in your ear telling you, oh, here's the crematorium that we recommend,
so off you go.
It's okay to say, I'm going to think about this. It's
and this is the reason that we're making this video, just because we've had friends who felt rushed, and we're given advice that wasn't accurate at the time of passing, and it's always a regret that that they didn't have the calm around them to make the decisions that they wanted to.
I think it's hard enough if you've had to decide to help that pet on their journey, to have them euthanized, and it's always a difficult decision, but at the same time it is one of the greatest tributes we can pay to our loved ones, to put our own emotions aside and do what's right for them. Absolutely. And I think that's important. But then if you've already had to make a decision like that, or you've seen your animal through accident or whatever, that they've reached a crisis point, that's so distressing too.
Yes.
And most of us don't, we don't do Even people who do funeral plans for people, even people who are at end of life with cancer things and planning their own funerals, you can tell yourself as much as you like that you're prepared for the moment when it actually happens, but you can never prepare yourself for that moment.
No.
So having all that going on and then having someone tell you, well, we'll take the body, we'll call the crematorium, you go home now, you know, hand us your credit card on the way out, or we'll send you the bill.
Oh, yeah, you don't need to get caught in that cycle.
No,
they can wait.
That's right.
They
Absolutely.
can wait. Yeah. Thank you so much. Is there anything else that you wanted to mention about the body after death? Or
I don't think so. I think we were talking about potential drug interactions and whether that could, you know, extend the deterioration time of the corpse. And interestingly, there's not been much research on this. They've started to do a little bit more in people, you know, people who are on masses of different medications. It doesn't seem to in terms of what we're talking about in an in-home situation. Certainly something like the barbiturates that they use for euthanasia, they're central nervous system depressants, so they're not going to affect the tissues differently. There've been some weird studies, and this is a little bit, you know, again, talking about these horrible, gory things on the internet, you know, bodies in the bush, human bodies, because we can talk more easily about human bodies, at least I can.
Not so much.
You know, if they've been on some, you know, if they've been taking Valium or, you know, some sort of, you know, mood altering thing, and it's in their bloodstream, apparently it does affect the microorganisms and the insects that come, you know, that they all move more slowly and develop more slowly, and really weird things like that. But antibiotics, no one's studied whether someone who's on an antibiotic if that's going to affect that deterioration process. And then I suppose it would depend, was it for a minor infection, or if they were on an antibiotic for a major infection, was there still bacteria? There's so many variables, but certainly nothing definitive to say that any sort of medication is going to impact on that time afterwards.
Thank you. That's so good to know, isn't it? And it's something that you wouldn't, how could you ask your vet that question, you know, at the time? So it's just, thank you. Thank you so much.
Yeah, great.
I just wanted to talk about one more thing, because I know when Leonardo passed, you had something, you just had something really beautiful done with his ashes.
Yeah.
With a little piece of his ashes.
I've got it here. So I found these wonderful glass blowers in Victoria, and you can send them just a teaspoon of ash.
Can't see it.
And I'm gonna hold it up for you in a minute. I'm just
sorry. I'm impatient. I'm saying don't be rushed. Don't be rushed.
I'm patting it at the moment, which is really interesting. So, and you can choose colors, and what they do is you can do little hearts, and I've actually had hearts made for some of my other doggos. But this is, I'm just going to find a blank piece of paper here so I can show you properly. So this is Leonardo, and there's, you can see the little white, can you see the white swirls in there? So that's the ash, and the others are the colors that I asked them to put in there, because he was, you saw from his photo, black and tan and white. So they put his colors in there and swirled them through with his ashes. And so that sits on my bedside table.
That is so beautiful.
To his picture, yeah. And
I feel
so
like
that's,
I can see him.
And the other thing I actually did, so I've got some of his ashes here, but I got a little tin and I kept it full of ashes, and I took it out with me on our walks. And at all his favorite places, I put just a little bit of his ashes in all his favorite places on the walk. So,
oh, wow.
Yeah.
Wow. That's just beautiful.
Yeah, and so if, you know, when I walk there now, I still think, oh, he loved this spot. He loved this spot.
Yeah. And he's still watching you, still walking there with you.
That's it.
Oh, beautiful. Thank you so much. When we started recording this, we were saying, you know, it's so much easier to talk about what happens with the spirit after death, and to talk about grief and all those types of things, because, you know, that they're topics that kind of come more naturally to speak about, I think. But this topic, it's, you know, the cold hard facts of what are we going to do now we have this body in front of us, and to have you be able to talk about this, you know, there's not a better person in the world to do this for people. So thank you so much.
Thank you, Nicole. It's been A little bit grueling at times, but I think it's been a really good discussion too.
Yeah, me too.